Does blood type correlate with risk of coronavirus infection or even death? There are many blood types including A, B, and O. Let us summarize the different antibodies produced by each blood type. Blood type A produces anti-B antibody. Blood type B produces anti-A antibody. Blood type AB produces no antibody. Blood type O produces both anti-A and anti-B antibody. Some studies are suggesting that if you have, say for example, have blood type A, you have increased risk of infection. A study from China looked at over 2,000 COVID-19 positive individuals, and they reported that there was a higher rate of infection among people with type A blood. Also, the commercial DNA testing company 23andMe has reported that their analysis of over 750,000 genomes shows a similar pattern by different blood type groups. It's important to point out that their data is not published yet, but they showed that the infection rate was lower in type O individuals and higher in type A individuals, although the overall rates of infection were low among the different blood types. The question is why? We do have some clues from in vitro studies, meaning studies that are done in lab, where they did this research on SARS. SARS is a virus that broke out back in early 2000, but this study was done in 2008, where they found that anti-A antibodies inhibited the ability of the viral spike protein to bind to its receptor, which is called ACE2. And ACE2, which stands for angiotensin converting enzyme 2, is a receptor that the coronavirus uses to gain entry into the cell. So every virus has a protein on its surface and some other structures, and they use that information to bind to a cell and gain entry into a cell and eventually infect the cell. So one leading theory tells us that the people with blood type O might be protected if they have some anti-A antibodies in their system. Interestingly, people with type B blood also produce anti-A antibodies, and so far we have not seen protection in these patients, meaning patients who are type B blood. And this raises question in terms of the ability of anti-A antibodies to protect people against the coronavirus infection. Interestingly, people with type B blood who also produce anti-A antibodies, for these people we don't have enough evidence to suggest that they are protected against this particular infection, which also raises some questions. Another possibility is that the antibodies generated against the virus are maybe cross-reacting with the blood group A antigen, which gives rise to blood clot. And blood clot is one of the big known outcome, meaning the negative outcome in patients who end up developing COVID-19 as a result of the coronavirus infection. Some researchers also found that there are stretches of DNA that are implicated in causing a severe form of COVID-19, and this area of the genome also codes for genes that are responsible for the different types of blood groups. So there's an overlap, and that also provides us with more information. In this study, people with blood type A face a 50% greater risk of needing oxygen support or a ventilator, meaning if they end up in a hospital setting, whereas people with blood type O appear to have about a 50% reduced risk of severe COVID-19. Thank you for watching ScieHeal, where we break down complex health topics into digestible form. Subscribe to our channel, and please leave us a comment, and we will respond to your questions in a timely manner. Thank you again.